Hi everyone, my name's Stephen Clark. I'm the clinical nurse consultant for PACS. I'm here today to talk to you and instruct you on the insertion of suprapubic catheters within the aged care facility for accredited staff who have attended training and have met the competencies. So there are advantages and limitations to suprapubic catheters. Advantages: reduced risk of catheter contamination with microorganisms commonly found in the bowel. Greater comfort, particularly for patients in wheelchairs, easier access to insertion for cleaning and catheter change, and easier to maintain and care for. There are some limitations. Insertion is an invasive procedure. The patient still may leak urine via the urethra, and specialised training may be required for health professionals and carers to change an SPC. The reasons why your resident may have a suprapubic catheter within your facility: acute and chronic urinary retention that cannot be adequately drained with a urinary catheter. This may be preferred by the resident for their needs. Acute prostatitis, urethral stricture or obstruction, urethral or pelvic trauma, complications to long-term urethral catheterization, when long-term catheterization is used to manage incontinence and to protect a perineal wound from urinary contamination. Any resident with a history of spinal cord injury at or above T6 level must be considered at risk of autonomic dysreflexia. This is a sudden and severe increase in blood pressure, resulting in overactivity of an isolated sympathetic nervous system below the level of injury. Just ensure that you review all notes and previous catheterizations prior to proceeding. What the clinician must perform before the insertion: they must confirm the resident and the patient's identity, confirm that the resident and patient requires the catheter changed, check the facility's medical records for previous insertions and ensure no history of insertion difficulty. Critical steps at this procedure require the removal of the old catheter and insertion of the new catheter. Consider the planned procedure and critical steps prior to commencing. Perform hand wash prior to entering the resident's and patient's room. Clean and prepare trolley. Gather all equipment for the procedure. Bring the bed to a suitable height. Resident in a supine position on their back with a buoy placed under the resident. Expose the SPC site. Twist the catheter gently to ensure the balloon is sitting on the bladder wall and there is no adherence within the SPC tract or stoma. Using a 10mm syringe, passively deflate the catheter balloon, but leave the old SPC in situ at the moment. Remove non-sterile gloves and perform hand hygiene. Arrange equipment on the sterile field. Remove covering from catheter or expose the catheter tip. Open sterile water and draw up 10 mL within the syringe. Empty normal saline into the dressing pack. Apply lubricant to the tip of the sterile catheter and lay it back on the sterile field. Soak the gauze in normal saline and clean the SPC site. Clean around the SPC insertion site with pre-soaked gauze in a clockwise direction. Have the tray with the catheter within easy reach and place it onto the drape. Let's insert the catheter. Remove the catheter with one gloved hand aseptically. Consider using non-dominant hand and removing the suprapubic catheter from under the drape. Insert the new catheter immediately with the other hand, your dominant hand, above the drape. Continue to insert the catheter another 2 to 3 centimeters as urine appears. Inflate the balloon in accordance with the product recommendations, then gently pull back on the catheter until resistance is felt. Throughout this procedure, observe the patient and ensure signs of comfort. If possible, have 2 clinicians at insertion. This can be very helpful to keep the resident within the position you need them for the insertion. Apply the catheter strap or the disposable catheter fixing device. Ensure the catheter is well supported by a fixation device. Remove your personal protective equipment and perform hand hygiene. Dispose the waste in accordance with your infection prevention policy. Now all we need to do is document within the medical records, whether they be electronic or hard copy, the full procedure, the size of the catheter, and any complications or concerns you may have had during that. This is so important to ensure the safety and comfort of the patient. As you know, it is so important to ensure the SPC is changed regularly, checked regularly for patients' comfort and their long-term medical health.